Namaste to all of you. The intention of this video clip is to make sure that more and more Ayurvedic doctors are encouraged and inspired to have a Rasa Shastra based, fast acting, reliable, proven track record and most importantly safe combination of herbs, kind of same way minerals and metals combinations that can be used even in an ICU setup or to bring very quick, reliable, safe results. This is the objective of making this video. And we have with us Dr. Aswath Rao, who needs no introduction for the Ayurvedic community, being the doctor who has implemented Rasa Shastra medicines in ICU in COVID. And we already have you will see in that video description, the link of the webinar that happened in Sitaram Achar Rasayana on 23rd of January. So I will hand over the further details narration to you.
Namaste everyone. In this video clip, I would like to briefly demonstrate the way Hemagarbha Pottali can be used. The reason being, in the recent past I have received messages from many Ayurveda students regarding how it should be used, the dosage of the medicine, etc. So to give a brief introduction about the medicine, for example, if I am using Hemagarbha Pottali of Govt College Pharma, they will be definitely mentioning the dosage of the medicine, Anupana, etc. in the details provided attached within. So for example, this medicine contains 1 gram quantity. So for example, the need of the medicine is according to the condition of the patient or the experience of the Vaidyas. When I have to decide, for example, when we know that we have to rub this medicine in a stone, some people ask how many turns should I rub. So I feel instead of deciding the number of turns should be used, because it depends on the pressure also we use. So instead of remembering the number of turns, etc., I feel, for example, if I am using this 1 gram of medicine in a span of 15 days, or my dosage is 1 gram for 15 days, I need to finish off half of the quantity for 1 week in divided dosage, morning and evening. So what I tell is to most of my patients, instead of remembering, for example, different attendants might give the medicine, their pressure might be different, so hence the dosage might vary. And we need not worry much whether the medicine gets out 2 to 3 days earlier, or if the medicine is used in a span of 20 days, which you have prescribed for 15 days, nothing to worry. Before using the medicines, there are few things to be kept ready. For example, freshly prepared ginger juice. I think when we have to use it for a duration of maybe 4-5 days, better to freshly prepare it every time. Instead of storing the juice in the refrigerator and using it, I feel it is better to use freshly prepared juice. And a glass of water and honey. With these 3 things in hand, we can start the administration of the medicine. Just around 1/4 spoon of, I can say, tablespoon of water can be, just 1/4 spoon is enough, can be put into the stone provided with the medicine kit what is available. And keeping the dosage that has to be administered, we can decide the number of rounds that we have to rub the stone or the pressure that we have to put, etc. For example, after using the medicine, I can just cross check how much of the medicine has been utilized. This will be very much evident when I compare the medicine before using and after using. So for example, after I get a medicine which is freshly prepared medicine, I should add just 3 to 4 drops of ginger juice. And 1/4 teaspoon of honey. And of course, we know the Anupana differs with different Pottalis, so it should be used accordingly. And after mixing the medicine, honey and ginger juice, it should be thoroughly mixed. And now it is ready to be administered. Sometimes the patient can be critically ill. In such instances, the attender can give this medicine to the patient or help the patient to take it sublingually, or if the patient is fine, it can be taken by the patient himself. My dear friends, when patients come to me and when I demonstrate these medicines, they ask how safe it is to take. This is the best I can do. I can take the medicine in front of the patient and assure the patient about its safety. Of course, I cannot prove the efficacy. We get to know the efficacy within 2 to 3 days in some critical conditions. So with this confidence, I think we can convince many patients the utility of this wonderful emergency medicine. Thank you.